those people, that population. The poor neighborhoods on the west side, they don't follow our recommendations. It's not our problem. Only the migrants are getting infected. The community is not concerned. Did any of these statements make you uncomfortable? Did they make you cringe a little or a lot? These are statements I have heard throughout the COVID-19 pandemic response here in Utah. But this mindset isn't unique to Utah. When COVID-19 was first identified in the United States, national leaders were calling it the Chinese virus, and Asian American communities across the country experienced racist attacks. And as COVID-19 has spread, we have seen worse health outcomes in already marginalized communities. American Indians and Alaska Natives are 3.5 times more likely to be infected with COVID-19 than white populations. Black and Hispanic populations are twice as likely to die from COVID-19 as white populations. Globally, this pandemic is exposing the gap between the wealthy and the poor nations. This is a health crisis, but it is not only a health crisis. The World Bank warns that this virus could push between 40 and 60 million people into extreme poverty this year, with sub-Saharan Africa and South Asia hardest hit. But at the beginning of this pandemic, we were all susceptible. There was no treatment, no vaccine, no one was immune. We were all equals. And the ways to protect yourself from COVID-19 are pretty simple, right? Stay 6 feet away from others, wear a face covering, wash your hands. So why then does the risk of being impacted by COVID-19 depend on skin color, the language you speak, where you live, or where you work? Well, let's think of life before COVID-19. I've got a couple scenarios for you, and I'm sure most of you can relate to at least one of them. My husband and I both work full-time. We have 2 young children and no family around, so we rely on school and childcare to make our lives functional. There have been times, more than I will admit on this stage, where one of my sons would feel sick at night. In the morning, he'd seem okay. Just slip him a little acetaminophen and head him off to school and hope that the school wouldn't call me in a few hours to come pick him up. Maybe a more common scenario. You wake up with a mild cough. You're feeling a little tired, but you have several important meetings that day. You take some cold medicine, head into the office, and go about your regular routine. Falling behind for something so mild just isn't worth it. Now, during COVID-19, these 2 scenarios are completely different. There's no way I'm sending my kid to school or going into work if any of us are symptomatic at all. I don't want to risk spreading COVID-19 to anyone. Plus, I have plenty of paid sick leave if I need to take time off, or I can work from home if I feel well enough to do so. The risks of sending my kid to school or going into the office outweigh the benefits. Now, another scenario. Probably one unfamiliar to most of you. Imagine you are a 27-year-old refugee from Somalia. You live in a small apartment with your extended family. You came to Utah 8 months ago after spending 5 years in a refugee camp in Kenya. In order to become quickly self-sufficient, you take a job at a meatpacking plant. There, you spend 8 hours a day, shoulder to shoulder with your coworkers. You get paid by the hour, you don't have any sick leave, and obviously no way to work from home. You know, you've heard of COVID-19 and that young people typically don't get that sick. So when you wake up with a sore throat one morning, what do? Do you stay home, miss 8 hours of income, and have to worry about how to pay for groceries next week? Or do you go into work with that sore throat? I bet you'd go into work. In that situation, in that moment, the benefits of going into work while you're sick outweigh the risks. You know, protecting yourself and your family from COVID-19 is definitely easier if you have higher socioeconomic status. Anyone who tests positive for COVID-19 is asked to stay home, away from others, for at least 10 days. And they have to give the names and information of all of their close contacts to the government. This is so the government can tell their contacts that they too have to stay home, away from others. Then, if any sick individual lives in a household with other people, we ask them to use their own bedroom and their own bathroom. When public health can't identify how individuals are getting infected, that means we have community spread, and all individuals are asked to stay home in order to stay safe. That works well for people with big houses, or those of us who can work from home. But what about the rest of our communities? It's no surprise that our hotspots of COVID-19 in Utah have occurred in tourist town apartment complexes, where workers in the service industry live, and in communities where health and economic disparities have been prevalent for years. This virus has shown us that while we are all clinically susceptible, the disparities ingrained in our society have allowed specific populations to bear the biggest burden. You know, COVID-19 came to Utah initially from people who were infected while they were on international cruises, and from tourists who were in town on ski vacations. And for a while, we had no secondary cases. All of our cases and their contacts were able to stay isolated. We were patting ourselves on our backs. But then, on March 4th, we had our first instance of community spread. A worker at a local restaurant, likely infected by someone in town on vacation. And from there, more community spread was identified, changing the demographics of our cases quickly. On May 27th, the number of Hispanic individuals in Utah infected with COVID-19 surpassed that of white individuals. And for the next several months, the burden of disease continued to shift away from white populations and toward persons of color. You know, even though Hispanic individuals only make up 14% of Utah's population, at its peak, they made up nearly 50% of our COVID-19 cases. While the Utah majority was physical distancing and staying home, the Utah minority was working in essential jobs. They were producing our food, keeping our lights on, and keeping our water clean. They were putting themselves and their families at risk for being infected with COVID-19 every day. I-15 is an interstate that separates Salt Lake County into a west and an east side. Communities west of I-15 tend to have lower education, less income, higher rates of racial and ethnic groups, and more individuals living in one household than the east side. If you live west of I-15, you're twice as likely to be infected with COVID-19 than if you live east. But we know the virus can't see socioeconomic status. The virus doesn't know the skin color or language spoken by its host. It can be the great equalizer. We saw COVID-19 spread like a wildfire through our refugee community in northern Utah and then into surrounding communities of a variety of races, ethnicities, languages spoken, and incomes. This pandemic has taught us that we are all interconnected. I know so many of us want to erase this pandemic experience from our memories. It has been painful. Health disparities hurt us all. The virus doesn't stop at neighborhood borders. This pandemic has also highlighted the interdependence of our physical and economic security. When one community suffers, we are all more vulnerable. But it does not have to be this way. As Winston Churchill is credited as saying, "Never let a good crisis go to waste." So I urge each one of us to use this pandemic as a catalyst to effectively address the health disparities that have been fracturing our society for decades, yet magnified by COVID-19. Each one of us has a powerful voice, and we must use that voice to strengthen those who society has ignored. You are part of the solution. Let's create security now throughout our communities so that we are all safer in the next crisis. And let's do that by fighting for living wages, to support physical and economic security. Paid sick leave, so that no one has to choose between staying home when they're sick or putting food on the table. Affordable housing, to ensure that all of our communities are safe environments where people can thrive. and access to quality healthcare, allowing individuals to focus on disease prevention and general wellness. Because the health of each of us depends on the health of all of us.